Hi, I'm Dr. Christopher Palmer. I'm a specialist in robotic total joint replacement surgery. And if you've just had your hip replaced, we need to discuss what the post-operative instructions are. After your surgery, you'll have a dressing placed on your hip. And then at 2 weeks, we'll change the type of dressing to just gauze and tape. We give you an extra bandage for emergency purposes only. Those emergencies may be if the bandage comes off, if you get water underneath the bandage, or you bleed through. Otherwise, we want you to leave that bandage on for the 2 weeks. For the first 2 weeks is when the highest amount of inflammation occurs in the body. So for those first 2 weeks, it's extremely important to ice your hip pretty much 24 hours a day. The other is keep your leg elevated when you're resting. Try to get the swelling out of your leg as quickly as possible. We will give you some sort of compression wraps to wear on your legs, and we want you to wear those for the first 2 weeks. The other thing we want you to do is get up and walk every hour you're awake. That's going to decrease the chances of getting a blood clot, pneumonia from just sitting around. It's also going to keep your hip loose so you're able to move and feel better. We don't want you overdoing it. I tell many of my patients that after a hip or a knee replacement, it's kind of like you're walking on a tightrope, and you can fail if you go on each side of the tightrope, meaning if you do too much and go one way, you can fail. If you do too little, you can fail. You really should only be walking about 1,000 steps a day for the first 2 weeks. So I recommend my patients get a step counter and watch that and try to stay right around about 1,000 steps. We'll have you go to therapy usually for about 6 to 8 weeks after your hip replacement, sometimes longer, sometimes shorter, depending on your needs. What I tell my patients is only you can do it. No one's gonna do it for you. If you don't do it, you will regret it because you'll get stiff, you'll get painful, and we can't go back in time and redo it. We have one window to get this done. Other important instructions are taking the medications as directed. We will give you something to avoid blood clots, whether that's aspirin or something stronger. We will make that decision based on your medical history or if you're on a medication before. We will also give you multiple medications to control your pain. We're trying our best to avoid narcotics. We know that narcotics are necessary at this point, but we want to get you off them as quickly and safely as possible. We want to see you at 2 weeks. That will be your first follow-up. Check your wound, we'll get new x-rays and make sure everything looks okay. At that point, that's when you should kick it into high gear with physical therapy and put your full effort into getting your strength back, your range of motion. Most of the time at that point, you'll be at outpatient physical therapy working very hard 2 to 3 times a week. Your next follow-up with us will be at your 3-month mark. Most patients are satisfied, happy they did it, doing just about anything they want to do. At 6 months, it should just be cruise control, and we should only have to see you on a yearly basis after that. We're obviously there for you if you need us. You can always call us. You can always come in early if you have any questions or concerns. And I can be your trusted guide through this process and help you through, answer any questions you have. I know having your hip replaced is a challenging process, but I've seen countless other patients go through it. And I want to encourage you that you can do it too. We've done this many times. If you follow our instructions, it will keep you safe, it will protect you, and it will help you along the way.